first of all, I wanted to sort of give you an awareness or some understanding of the prevalence of dementia amongst Māori. And so in 2020, it was deemed about 70,000 people suffered from dementia, and of that 70,000, approximately nearly 4,500 were Māori. But those numbers are underrepresentative of the true state or the true prevalence of dementia out there. The reason being that the bases or the resource bases that the START is drawn from is underrepresented by Māori, and also because a lot of the START is drawn from studies or epidemiological studies that are conducted on Indigenous people in other countries. So in actual fact, I think that it's highly underrepresentative of the actual number of people or Māori out there who are suffering from dementia. And anecdotally, I've talked to a lot of allied health workers who are out there who tell me that, for example, one occupational therapist said she goes to a little place in the North Island, and she said, I swear, 1 in every 3 kaumātua there has got dementia, but it's undiagnosed. And I said to them, but why? I said to her, why is it undiagnosed? She said, because they don't want to go to the hospital, they don't trust the hospital system, and also because they don't think that there's any cure, there's anything that can be done for them, there's no support, so why bother? So in light of that, what we are going to do is myself and my team of researchers at the University of Auckland have been funded to conduct a prevalence study of dementia amongst Māori, and we are underway. We are actually starting data collection in the far north in January, and we are moving through the mutu. We are going to be door knocking, not on every door, but in lots of areas where there's a high density of kaumātua of Māori elders over the age of 65 years. We are coming to Gisborne, which I'm really delighted to announce, because often from up in Auckland, the research that is conducted, we kind of leave out Gisborne because it's kind of a little bit more out of the way, and a little way that we are coming here. And I've been speaking to local iwi about this kaupapa over the last couple of days, and I think that they are pleased that we are going to be coming here and including Ngāti Porou. Anyway, so other factors that add to the prevalence of dementia in Māori are the fact that Māori suffer from a higher, are overrepresented in the comorbidities that are associated with dementia, such as diabetes, such as cardiovascular disease, obesity, repetitive traumatic brain injury, and so on. And often what's not mentioned is that Māori are often in low socioeconomic category, and low socioeconomic status is associated across with any medical condition, in fact. And furthermore, there was a small study done out of the memory clinic at Middlemore Hospital, and it showed that Māori are likely to be much younger when they receive a diagnosis of dementia, up to 8 years younger, which is a huge amount of in terms of years, and which means a lot more Māori who are going to be suffering from dementia. Of course, also Māori are ageing at a faster rate than non-Māori. So there's a double-edged sword there. I mean, it's great that we're living longer, but unfortunately, associated with living longer are age-related diseases such as dementia. I want to talk about a large study that we did that was throughout the whole country, and this is what we've based a lot of our outputs on. And we toured the country, and we spoke to over 300 kaumātua and whānau and asked them what their understandings and experiences of dementia were. And we came up with they came up with quite a number of different themes and aspects of this disease that they wanted to talk to us about. The aims was to get this understanding, but also of dementia, but also to design and develop a diagnostic tool that would be valid and appropriate when assessing Māori for dementia. So I'm one of these Māori researchers who believe that research should be done by Māori, at least led by Māori, with Māori. So on the left-hand side, they are all my team, and they all whakapapa to Māori. On the right-hand side are the wonderful non-Māori researchers, academics, clinicians, who are experts in the area, who have given their time and their energy and their aroha to help this kaupapa, and it's been amazing. And so together I've had such a wonderful team to work with. We have published twice already on an understanding of and the experience, and those are the references there if you want to do some reading. So one of the main things that came out of our research from the kaumata was that they didn't like the word dementia and all the negative associations that go with that. And actually, I don't think anybody likes the word dementia. There is a stigma associated with it. So, which is people working in the dementia sector are trying very hard to diminish, to mitigate. But anyway, so we decided, or the kaumata decided, we want to have our own word, and we came up, the most common and accepted term across all the iwi, across all the rohi in New Zealand was the term mati wareware. Mati in this context means to be sick or unwell, and wareware means to forget. So, I mean, I very, very rarely use the word dementia anymore. I use the word mati wareware, and it's a natural part of my vocabulary, and it's helping to create our own narrative, our own space, if you like, around this disease, which doesn't necessarily have to all be negative. When a person is diagnosed with dementia, it doesn't mean, it doesn't mean the end of their life. It doesn't mean it's not all doom and gloom. Often there is a lot of good quality of life that still can be lived, and that's kind of the positive aspect of this disease that we're trying to promote, and just really mitigate all that negative associations that one usually thinks of when they hear the term dementia. So mate wareware is the term that I use, and it is actually adopted by most of the literature and government publications and so forth. One of the good things that came out of this kōrero was the protective factors, what the kaumata thought were protective factors in warding off mate wareware or slowing down the progress of mate wareware. And when I looked at all these protective factors that were mentioned, I realised actually what the protective factor is our cultural identity. That going on the marae, and I heard many stories of Nani or the koro coming on the marae who had mate wareware, and they would say to me, they would come in and they would sit there, and it's like the mate wareware just evaporated, and they became normal, and they functioned just like anybody else. So we didn't have to worry about her or him. We would just leave them. And that's because they're going into an environment that is familiar to them, that is where they feel lots of love and where they feel safe, and they're practicing behaviours. So I've been talking to a lot of, we go to a lot of marae, Sir Richard Fall and I go to a lot of marae and talk about going to, our kaumata to another, to go to the marae, to interact with each other, to speak the reo, access those long-term memories, which many of our kaumata still have memories of their te reo, which was their first language, but in many people was suppressed and haven't been used. And we often heard the story, granddad or nan would start speaking the reo, but she never used to speak it. So, it is an opportunity. It does allow those long-term memories to be accessed after the recent memories have the ability to remember recent memories has diminished. One of the other themes that came out of the research was the lack of information. And to me, this is a crime. Mate wareware can be reduced. There are modifiable risk factors. They were published in 2020 out of the UK. As I've been saying to the people I've been speaking to, there's no guarantee. But if you can live a healthy life, essentially, that's what it boils down to, if you can modify the risk factors, you can prevent the onset of, according to this research, you can prevent the onset of mate wari by up to 40%. So this is really important to know, but our people don't know this because they don't get any information. I tell the story about a time when I gave a presentation. It was virtual, and anyway, a few days later I received this box of goodies in the mail, and it was full of pamphlets and handouts and manuals and so forth about information about dementia. And I would say there would have been at least 100 different sort of bits and pieces in there, and there was only one piece of information in there that had any connection with Te Reo Māori or a picture of a Māori person there. So there's no information for our people, and even less so for those Māori who are living in some of the more remote areas. There's not only are there no services and support available, but there is no information available, and that's a crime to me. So we decided to develop this app. It's freely available. You can all just type in matewariwari.co.nz and it will appear. And there's a lot of information that is accessible to our whānau, including videos of other whānau who have lived through this experience. What I wanted to talk about was an intervention. This is a non-pharmacological intervention that is available, and it's a group activity program. It's available. It was designed in the UK. It's called cognitive stimulation therapy, and I looked at it and I loved it. I love the platform because I know that our kaumātua love coming together. They love interacting, and being socially connected is an important factor in mitigating the onset of dementia. So we got together, the team of us, we adapted it, and now we are running programs, which is to teach, trainers to run the programs within their rohe, and that is called haumanu, whakaohoho, whakaro, and essentially it's a Māori-friendly, appropriate program, which is non-medical, which doesn't include pills, but it does bring people together with interesting activities that they love, and challenges them in a gentle way. I just want to talk about the mana very quickly. It is a tool that we have designed and is being launched on the 12th of December up at Med School in Auckland, and it is a valid tool for detecting mate wari and Māori. It will be introduced into the main stream for clinicians to use in this country when they are looking to detect mate wari in their Māori patients, and it's something that we're really proud of. There are three components. The first component is the wairua component. It's really just a rapport building part of the process or of assessment, but it's a really important part. That's the part that our kaumātua told us was most important to them, was their spirituality, their spiritual well-being. So we've included that, and a lot of medical doctors have come to me and said, well, can we use that component for our patients who are presenting with other conditions? And I said, absolutely. So, and this is just an example of what it looks like. And that's the end of my kōrero. Thank you very much. Kia ora.